Stretch. Here we go. Very nice. Wow, that was one of the best ones. I hate to say that, but that was actually one of the best. You all right?
Yeah.
That was phenomenal. I mean, that was really cool.
You know, this is really more intense than it looks on the camera.
I would call this a hyperkyphosis, right? So it actually is more elevated on your right side. Oh boy, yeah, this solid granite. There we go. Yes. Baby, my heart's on fire. If you refuse me, honey, you lose me, and then you'll be left alone. Oh, baby, telephone and tell me I'm your own.
Yeah, so the upper back pain is actually started initially a couple of years ago with just one spot right here,
Okay.
right on the left hand side. And then after just a few months, just right this point right on the right hand side, exact opposite point, started having issue.
Okay.
And then after a few months, the left back of the left shoulder
Okay.
started having problem like this area.
Okay.
And then around maybe this area.
Uh-huh. So not here,
No.
but more the back part of the.
Mm-hmm. Yeah, I would say around this area.
Okay, just muscle bellies. Okay.
Yeah, but that has been going on for a while.
Okay.
And now I do train very often,
Gotcha.
right? I
Yeah.
do like anything from lifting, CrossFit type training, a lot of things, and I don't really have any gaps in my training like ever, so I don't know how much that is impacting any of this.
Okay.
But that's one thing. And then I was talking about my upper back pain. Then after a little while, it started sort of spreading out more.
Okay.
So now going up a little bit to the upper traps, and then a little bit down to the mid back too.
Okay.
So that area has been pretty much problematic. Now there is one more. I mentioned the right pecs.
Yes, sir. Yeah.
So that right pecs, way before this one, I had an pecs injury, and then pretty much ever since then, my right pecs gets very pumped up. Like when I do any sort of bench pressing, push-up, and stuff like that, gets pumped up a lot more quicker than the left-hand side.
Okay.
And even without exercise, sometimes it just gets very tight around this area. The tightness also I experience it here, and then to the neck as well, and then sometimes down to the armpit, go down behind to the scapula, even to the ribs sometimes.
When you said you had an injury, what do you mean by? Did you have a?
Yes, I was doing an overhead pressing,
Uh-huh.
and then I felt something like a tear, and
Uh-huh.
I heard something like a tear, and then it started severe burning
Uh-huh.
in this area right
Mhm.
here.
How long ago was that?
That was, I would say, 3 years ago.
Okay. Okay.
And then for about, I would say, 6 months,
Uh-huh.
every time I was pushing,
Yes.
I was having a little bit of pain here.
Okay.
Then that went away, and then that tightness started.
Okay. Yeah. There's an injury and your body healed, and now the tissue can, still it doesn't replace with the same stuff. Your body doesn't heal with the same material that was originally there. This is where the gua sha, that combing that we do,
Yeah.
that's a really great way to untangle. So you can have tangles in there, and then the tissue, by it being tangled, it clogs itself, and so that has to be untangled in there to actually allow the tissue to be clean in there, and then it'll radiate pain into the surrounding areas. But that's 100% related to that tear you have in there. The shoulder blade is an interesting area because there is some overlap there. Because you're an athlete and you're doing a lot of lifting, overhead presses, there's going to be stress on your lower neck. And there's a poster behind my wife that describes that when there's stress on the lower neck joints, sclerotogenously, meaning that the bone actually refers pain to right between the shoulder blade. So the lower neck and the shoulder blade are not separate. They're the same entity kind of idea. But you also have ribs underneath there. And so you have ribs and joints and muscles. And so you can have a rib head that's out of place. And we'll adjust that and we'll see how that feels in a second. The back part, this is really, so the main two expensive things in the shoulder are the rotator cuff. So that would be pain, right in here on this little kind of U-shaped strip right here. This is where all the four muscles of the rotator cuff attached, but that's not where you're hurting.
No.
And then the labrum is the cartilage in here. Back here, this is called infraspinatus, right? This is a muscle right here.
Like rear dent. It's not really painful on the touch,
Okay.
but there are times that it just has pain.
How about try to take your arm and lift it up inside. I'm going to resist you. Does that hurt?
No.
Okay. Yeah.
It was on the eccentric. It hurt a little bit.
When you relaxed,
Mhm.
it pulled a little bit.
Mm-hmm.
A lot of that tissue in there, it's all replaceable.
Mhm.
You know, but it doesn't mean that it replaces well, or it replaces with the same material, or it doesn't replace tangled.
Right.
And so those are all just, I call it like stains in carpet that have to just be cleaned.
Right.
And it's not too difficult to I'll show you how to do that and everything. The main things in terms of long-term health of you is the discs. And that's where, you know, Ed, I'm here for these muscle injuries.
Right.
Fix my muscle injuries. I understand now, I'll fix them for you. But they're not generally what, the shoulder blade one is actually the most, it might not be your most chief complaint, but that's actually the most severe symptom you gave me, which is this guy. These two guys are a little bit more difficult because that indicates disc pressure. I'm more concerned long-term your health, the lower neck. And then actually the lower neck controls the, I'm gonna say, blood flow and nerve flow to your shoulder. So the health of the muscles in your shoulder come from the nerve. Kind of like if a nerve is pinched, you'll have atrophy, right? So when a nerve is irritated, where that nerve goes to, the tissue won't heal right. You understand? It won't be right. And so we're going to go through your spine, clean your spine out, and then we'll also check out your shoulder and that pack and everything.
So now before we get
Please.
started, there is one like an alignment complaint that I have regarding my shoulder. So now the first one, you just caught it right when you walked in, right? So but in addition to that, there is both shoulders are just rounded forward.
Correct.
Significantly. In addition to being rounded forward, this side there is an imbalance. I'm not sure you can.
So it's actually not, I mean, where you are right now, it's not rotated too far forward. You know, you're not, it's not like you're bowed like that. Does that make sense? That would be rotated forward. You're maybe a little bit, very slightly rotated forward. I would say your shoulders here, you're just a little bit.
Yeah, exactly.
You understand?
Right.
It's supposed to be here,
Yes.
and you're here, but you're
Yes.
not.
Yeah.
I wouldn't say it's severe, but it's very a mild rotation,
Gotcha. Yeah.
which, Ed, you know, I know you're an engineer and most of your work is in front of you, so a lot of that has to do with stretching. We have to stretch the ligaments on the front because they don't get stretched out as often.
Right.
The tilt is more of, it could be the injuries in the shoulder, but what I usually see happens is this: you have an injury to your neck goes into avoidance, and then your body has to have your eyes level.
Right.
So it's really a head tilt creating a shoulder tilt, which then does cause shoulder dysfunction and problems in the shoulders, but it's all ultimately from the neck not being.
That's, to be honest with you, that's the reason I'm here.
Yeah.
Because when I show this one to like, you know, other chiropractors or other physical therapists, more often than not, they say the issue is back is not strong enough to pull the shoulders back. And it kind of made sense to me. So I worked a lot on my back compared to the front, which was just naturally more dominant, but that did not really solve the problem.
Yes, sir.
So the way you explained
Yes,
it
sir,
in
won't.
your videos always, that made sense to me.
It won't work. It's not the job of your muscles to hold you upright. It's not your job of your muscles to be contracted to hold your shoulders back. You need to have good posture, and that's where you want to be. And when you're upright, actually really nothing should be contracted. When you're exercising, it contracts when it's used,
Right.
and then when you go to a relaxed upright posture, there shouldn't be contractions anywhere, right? It's not like it's contracted to have good posture. It's not the job. And then even if you do that, even if that were possible, now you have all this acidity that those tight muscles are creating all the time, creating soreness, inflammation. So let me look at the rest of your hips here.
That's not level either.
Yeah, I got pretty good. Your right hip is high.
Yeah.
Right hip is a good ½ inch high. So you're doing,
Yeah.
you know, you're. I'm curious what's over here that's made you lean away from it. Do you understand?
Yeah.
Because it's really a couple things happen. It could be your head. Do you understand? And then the hips, everything are following. B.J. Palmer, the first chiropractor's son, works almost exclusively on the upper neck because if the first two bones in the upper neck are not on straight, it creates a domino down to your hips. The lower back and the hips are an employee of the neck. And so I'm really curious to see what that neck feels like. Across this arm, under and over. Take a deep breath in for me. We'll sit up. Head back for me. Let all the air out. Beautiful. Deep breath in. I got you. Head back. Exhale. Let it go. It's okay. Relax, relax. All right, deep breath in. One more. Exhale. Chin down. What's that? Deep breath in. Exhale. Chin down. Very good. Very good. Okay. Everybody's moving. All right, side facing me. Top leg bent. There we go. I'm just going through your spine, making sure everybody's working. Just assessing. Do you have all the employees working? Deep breath in for me. Exhale. Uh-huh. Uh-huh. Outside for me. Good. Uh-huh. Okay. Take a deep breath in. Exhale. Yeah, plenty moving there. Face up for me. Face up. Mine. Oh, sorry. The job of a chiropractor is to find the parts of your back that are slackers, the parts that are not working properly. The parts that are moving, excellent. You're saying, or the parts that are moving too much, we want to try to give them a vacation. But when I'm scanning right now, I'm scanning the 24 vertebrae in your back, finding who doesn't work. So your head is straight on your torso right now. I have a huge knot here on the right side of your neck.
Okay.
Feel this?
Yeah.
That doesn't exist on your left side. This is a whiplash or a soccer injury, or what sport did you do in high school? Something.
Nothing really. We didn't do sport.
Something hit, but I'm saying I mean, it's enough that it's in like almost like a little
I feel it.
ball of gunk in here on the right side of your neck. We'll get it moving, but it's pretty big. This is what's causing the head tilt. You understand? Your neck has decided to go left.
Yeah, right.
And that's why your left shoulder's high. Do you understand?
Yeah.
When I ask you to turn your head right, it requires this knot on the right to compress, and it doesn't. You understand? When I tell you to turn your head left, it turned farther. When you went right, it was because you're running into this knot up here. Okay, we'll get it. Go for it first. Here we go. I got you. There you go. There you go. Gotcha. All right?
Yeah.
Yeah, very good. Very nice. Okay. So you notice when I was doing that, my hand's up here off the occiput. You're saying I'm contacting way up here. No chiropractor should ever adjust you into your lower neck. Because the lower neck, first of all, is where all surgery happens, and that's also the area that controls the in between your shoulder blade. The goal of my adjustment is twofold. One, we're trying to move the upper neck to take mechanical stress off your lower neck, and then also to loosen it for the purposes of restoring the lordosis and the arch in your neck. So it's wow, I mean, nobody's found this thing?
No.
Okay.
Because they didn't really do any of this. They just did adjustment.
I gotcha. But there's this right there. Oh my goodness.
Oh.
That. I mean, it clicks underneath my thumb a little bit. It's like a crunch. There. Watch, I'll show you. There's nothing on the left. It's like smooth. Does that make sense?
Yeah.
Like smooth sailing on the left side. And I have speed bumps, and there's a little guy there, but it's like maybe a third of the size or a quarter of the size. And then this right side, I have a house. Somebody put a house in here. I know, right? There. All right, see, your head doesn't want to even tilt to the right. Come on. There you go. You weren't born with this. Something happened. This didn't well, maybe it's just genetic, Ed. No, this isn't genetic. Something got whacked, and then it healed incorrectly, and now it has to be untangled. All right, come on. Because that would usually cause the left. The left would happen first. So the right upper part of your neck is tight. You're going to wear out the left lower neck. And I think when you were telling me earlier, wasn't the left shoulder blade was the first one, right? So the abuse on the left lower neck will cause left shoulder blade pain, and then your body will compensate and move the hot potato, and then it probably shifted over to the right. But I would say the first abuse or pain that this will create is left lower neck, left shoulder blade pain, because you're excessively stressing out the left lower part of your neck because you're in right neck avoidance.
Yeah.
Okay. we have a device called a neck dental, and I'll show you that in a minute. That's going to be your toothbrush we're going to use to model and emulate my thumb. And you can basically, I want to teach you how to do this at the end of the visit, how to, have a tool that can, as close as possible, hold you, makes sense, in the correct position. And then we mold this arch back to your neck. And that's where we're headed. We got to first soften your spine so that it's limber enough that we can actually change its position. If your spine is all stiff, then it won't. The stretching isn't very effective. Okay. There you go. Let it go. Yeah, here it comes. Right there, feel it? Yep. That's all.
It's pretty dark.
It's good. Yeah, just gotta. Both sides are clogged, but the right one is definitely more.
So how often this should be done?
The way we're gonna. When there's a curve in your neck and the upper neck is moving, you shouldn't need to gouache the neck all the time. It's like if you take your shoes off at the front door, your house won't be dirty and got mud everywhere. Do you understand? The goal is to teach you how to stop walking around the house with your shoes on so that there won't be so much mud tracked in. The alignment is incorrect, and that's what's creating the buildup. And many doctors or therapists will just want to just keep sweeping and cleaning, and that's not a bad thing, but it doesn't get to the root cause, which is your head's tilted and you have no curve in your neck, and those are the problems. I would say you got a military curve, and that's part of what a lot of athletes, when you're exercising a lot, it's most likely your neck goes straight, so you don't have much forward head posture, but there's no curve in your neck, and so you still have there's two things that happen: the tethering, there's actually the nerve roots are held tight, and the joints are under a lot of stress in the lower neck from the alignment not being correct. So even though the head's not forward, the military neck isn't correct either. Aren't you happy yet? It's over the no, because it's not curved, right? So the bar's even higher than just that. Everything in here replaces, but like I said, it doesn't replace with the same stuff.
Yeah.
So our body was made from gold, and then we heal with copper.
Yeah.
Right. So maybe like a street, right? When a street gets damaged, you get a pothole, they fill it, but the stuff they fill it with isn't the same stuff that was.
Yeah.
And it never feels right. Do you understand?
Right.
Now that doesn't mean we give up, but it does mean we can smooth it out and we can make it less noticeable, the transition between the uninjured tissue and the injured tissue. And something like 90-95% normal is what we can achieve. You understand? It's like a dent on a car. Sometimes I know there's some really good PDR, they call it paintless dent removals, and I've seen magic done work. My dad had a speaker fall off a shelf and land on the hood of a car, of his truck, and they pulled that dent, and you couldn't even tell. But my point is, unless you have like some professional do it, most of the time you pull a dent, you can kind of see a little bit of a ripple, you understand, that there used to be an injury. And in our human body, there's always like a little bit of evidence that it's like a scar on your skin. Your skin remembers, and internally when you tear tissue, the tissue inside remembers. Yeah, right there. There's an injury right there.
That's exactly what it was.
It's easy to find them because the body, it's like rubbing your hand over skin. You can feel the scar. Do you understand? You can feel where the scar is inside because it's all tangled. And kind of the first way of treating it is, do a couple rounds of gouache on it and see how, and then when the marks go away, how it responds and how it feels as it untangles and stretches. And I feel like the body tries to like pack the wound quickly to like stabilize it, you know, and then it's like, well, it kind of says it itself, over time I'll go in there and remodel it later.
Right.
You know, kind of like an old saying, I'll do it when I get around to it. You know, I'll do it later. And so then your body gets so, I don't know, occupied with other things that it never really goes back around to it, to something like that. I don't know, that's my thoughts on it. So by working on it, we can shine a spotlight on it and get your body to draw some attention to it.
And that front of that shoulder really hurts.
This is the AC joint. You're jamming the acromioclavicular joint, you know, over here. This is where all the, you know, this is the connection between the front and back part of your body. And you're an athlete. I expect the AC joint to be a little.
But you also mentioned in your videos that like when the shoulder is forward,
You jam this.
Right,
Yes,
jam
sir.
this, right.
Yes, sir.
So that's.
You have that happening too.
Right.
There's your AC joint jam right there. That's where all this. Yeah, there's definitely right in there that little crunch. There shouldn't be any. You know, kind of like right there, a little bit of a crunch
right,
in there.
Yep. So the fact the shoulders are forward is something is trying to avoid something in the back.
Well, yeah, that can be. It could be, yes, you could have an injury in the posterior
Uh-huh.
part and then that rounds forward to go away. But I would attribute most of it to just simply the exercises in the gym being more predominantly forward and life in general being forward. When we were growing as a teenager, we were sitting rounded forward. And so our life is more inundated with things rotating our shoulder forward than backwards.
Yeah.
So
Yeah, I mean that's
Could
like
be.
in my when I was in high school, we had to study a lot. Like I was like
Right.
sitting like 12 hours a day
Right.
studying like for and that at the time I wasn't doing like any exercise or anything.
let that arm stretch. Yeah, let that stretch. It's like, did I do something to have plaque form on my teeth? It's like, well, no, it's what you didn't do. You weren't. Nobody taught you that you have to brush your teeth, and then plaque was inevitable because we weren't. You know, our world didn't guide us on. You know, first of all, like I said, taking your shoes off at the door, and then how to brush and how to sweep.
Like you always say, like when you were kids, your dad.
Yes.
Always, like that's right.
Right away, we got adjusted. Yeah, we wouldn't wait months or years. You know, it was like, you know, soon after, it was so we didn't heal crooked, right? Because the compensatory injury is actually of a much larger severity is the effects of an injury, not even so much the injury itself.
Yeah.
It's the posture change. You know, those are the more lasting long-term effects. And I know in terms of time-wise, I'm going to spend more time on other parts of your body today, but actually the neck was that was actually the biggest injury in terms of what.
Yeah, that like you said, it all started it, right?
Well, that's actually going to be the thing that's going to still be here later in life. Do you understand? That guy is going to be the hardest guy to get rid of.
Right.
The shoulder, schmolder. Do you understand? I'm not. You stop working out so much, it'll go away. Does that make sense? Kind of idea. It's part of it is you're an athlete and you're really asking your body to work real hard, and that's great. But I'm just saying, the spine won't be something that just not doing stuff will remedy. Do you understand?
Yeah.
Like I'm not working out anymore, but my neck's still killing me. My shoulder pain's gone away. The neck isn't that simple, and that's why I'm in terms of what to making it to 90 years old. That's going to be our bigger monster. The spine controls all the health to the tissue anyway. So when the spine gets agitated, you know, the extremities get agitated. And the extremities are the boss of no one. They're being bossed around by your spine and your nerves. Wow, whoa. So this is all popped up. Now this is going again with, I was saying earlier, there's something on his left side that's being avoided. Do you understand?
Yeah.
You're tilting to the right, and you actually would abuse the right lower part of your back because of this. Now, there's a head tilt going on, but we also have a back tilt. Now, I would say this is a reflection of the neck. Do you understand? This creates this, but this in and of itself is going to create a bigger problem.
Right.
And our world, sorry,
No, you're good. I'm just.
our world doesn't care until you herniate a disc down here. Do you understand? And then all of a sudden, everybody gets on board with me and goes, yeah, his back's not healthy. Right?
Yeah, that exactly that right upper.
It's huge. It's huge.
Right, upper
Huge.
right is where when I do like deadlift and things like that. That gets always
You're abusing the right.
Abuse.
If it had been here till 41, it would now be frozen. Do you understand? If you waited another 10 years, it would be crooked and frozen. Right now you're just crooked, right? But it hasn't locked down completely yet. Because you're not in the right position, the joints are going to be under extra stress, and then that's going to force them to lock themselves down. And then the end game is always lumbar 4, lumbar 5, and cervical 5, 6, and 7 end up with 99% of injuries happen in 5 vertebrae. And it's the very reason that these areas are not moving that allow those areas to be beat up and abused. So restoring the function to your middle back. You'll feel it when we stretch in a minute. You're going to feel like you're not straight on the device. Like, I think your roller's crooked. No, the roller's not crooked. Your back's not level. And as you progress on your stretching, you'll notice that it'll feel like it's level again. You won't feel crooked on it. But yeah, I'm sorry nobody saw this huge left side of your back. It's all not.
I do use foam roller a lot on my back.
Correct, I understand. But even that isn't powerful enough to
Yeah,
do it
yeah,
unless you've been
exactly.
softened first. The roller is more of a retainer, you know? You have to be worked on and the tissue made supple, and then you can, work it yourself a little bit, but mainly retain it to prevent backstepping so that the next visit I can keep moving us forward. I mean, yeah, this is lifted up right here. These joints are under some stress. I mean, that right there's that joint's not happy. Like right here. Yeah, these are the roots of your neck also. So because your head's tilted, you understand your head's tilted to the left, you're going to abuse this. And then you're tilting your torso to the right. It's just dominoes its way down. But yeah, right there. I go home and I sleep very well at night because I gave my patients everything. And I think you could have gone a little harder. No, I really couldn't. That was it. I gave them everything.
Yeah, no, this is really more intense than it looks on the camera.
Aw. Yeah, I don't think I can hurt you on the side of his mouth. You're a little more invincible over here because it's already moving. It's not as painful. The left is more stuck, and that's why. Yeah, I don't think I'd hurt you on this side. This side's already.
Jeez. There's muscular injuries on top of them. It's just tangled. It's all tangled in here. Nice and smooth here. Look, it's like
Yeah, a lot of that, the upper head mobility issue I told you on the left hand side,
it's a
it
mess.
seems like because of that jammed up everything.
It's a mess. Oh. Yeah, you've busted this. Yeah. I mean, can you feel the difference? I mean, you've torn this muscle. Relax your arm. Relax your arm. Feel the difference? This is not nearly as contracted. I mean, look, that's just an absolute. It's never getting in. It's like you're leaving the engine running all the time. You're never turning the engine off. It's got a high idle, and the amount of acidity in the tissue is going to be enough that it's going to cause just pain in a broad area around it. Because now part of that is when you have an injury, your body expects it to happen again, so it puts up walls and it tightens itself in anticipation of another injury. And so it's part of it's that we have to convince your body that it no longer needs to keep the area in lockdown. You put it back up there, I guess. It's back better. There we go. When you talk about a hard spot to do it yourself. I mean, yeah, it's all. You gotta get that acidity out of there. I got you. Hello. Feel that? That's an injury. Feel the difference? See, soft,
Yeah,
soft, soft,
yeah.
injury. You tore it. It healed with scar tissue. Inside there's soft, and then nothing. There's nothing. And then right here,
Yeah.
it's kind of where you're pointing the other. This is soft tissue. Tangles. Ugh. So in this area, some of the fibers go laterally, like the rhomboids, they go left to right, and then the spinal muscles go up and down. So you kind of, and the gua sha is taught in different, depending on which angles you want to, which muscles you're trying to address. But in this area, both directions are okay because
the spinal muscles go up and down, and then the rhomboid muscles go side to side, so you'll see me working both directions. In the beginning of my practice, I used to say that something like 50% of pain is from the soft tissue, and I've revised that over the years to something like 80% is not measurable on an X-ray or an MRI, but it contributes heavily to actually your presenting symptoms. And I don't know, just nobody talks about it. It's like we want everything to be quantifiable and measurable on a blood test or a picture, and if it doesn't, it's like it doesn't exist. But it's like, no, this exists, but it's outside the realm of what can be. It can be felt and palpated, but it can't be measured like on an imaging or a blood test, because it's not inside the circulatory system. It's in the muscles, it's in the interstitial. But yeah, both sides were. This is what he was pointing to when you were upright. He was both. I think this is the spot that he was.
Yeah.
Yeah, this is the second spot right there. See, the mobility of the vertebrae is what keeps it clean, and so even though it moved, there was still some restriction here, and so if we get the area moving a little better, it should clean out for you. You shouldn't have to have constant need to, and we'll do that also through stretching. I got you, bud. There it is, nice. Very nice. Look at all that. That's where your spots. You got to get that out of there. That's contributing a large percentage for why you're feeling what you're feeling, and then keeping it out of there through the stretching and adjustments is the goal. Breathe. Exhale. Wow. Yes. Get the idea? Right? We got to actually arch your back to get those. I sat on you and it didn't move, right? But when I arched your back, I actually got it to go into place. All right, bring your arms up for me. Put your forehead right there on your forearms. Here we go. All right, breathe in for me. Here we go. Exhale. Stretch. Here we go. Very nice. Wow, that was one of the best ones. I hate to say that, but that was actually one of the best. You all right?
Yeah.
That was phenomenal. I mean, that was really cool. So I couldn't even adjust that face down.
Yeah.
When you were flat, I put all I had into it. Nothing moved. Then I had to arch your back. And then you get it to move, because it's so. Now it should move face down. It shouldn't need that. But the goal is, if after a few times doing that and stretching, it'll then move better for you, or that will move already. See, that should have already moved. There shouldn't have been any more air left in the joints. But there's a part of the joint that you're never really accessing that's got a bunch of crud in there. You have to. It's like you're going here, but then I want.
Oh boy.
You understand? I want more.
Yeah.
But you never access that because it's not really needed. But it's the full potential of what you should have.
Right.
What do I say? Like it responded to. It said, "Okay, I see." Like it said, I see what you're trying to do. Fine. There you go. Okay, I got you. Very nice. Yeah. You've injured these guys a little bit. There we go. Okay. I gotcha. Relax. Ooh. Yeah. Head to the left a little bit. Tilt left. Tilt left. There we go. Tilt left. Good. All right, go ahead and tilt your head right. Tilt right. Tilt right. Tilt to the right. Nothing on the top. Okay. I'm just curious. Check this shoulder. See if I can get something out of shoulder adjustment wise like this. All right. Look up for me a little bit. Now press back with your elbow into my elbow. There we go. Nice. Press back. There you go. Yeah. All right. Let me have you come over. You have a foam roller. Do you have?
Yeah.
Okay.
I have one of these too.
You have a dental roll? Okay.
You want to, it's the den roll, you're only in one position. You're trying to do like a detailed clean of a small area. The roller allows you to move around and you're kind of scanning the back. The idea with it is that you would scan your back with the roller, identify the stiffest part, and then put the den roll on it. And the goal is 20 minutes. You're not going to see any permanent change until you're getting to 20 minutes. You have to achieve the ligament stretch at 20 minutes.
10 minutes for every spot.
Right. Well, every time you get on it, 20 minutes, different spot. You got a lot of spots. Potentially, 10 vertebrae have to be. And so, the most bang for your buck is on the stiffest spot, right? So, and then that'll move. Where the stiffest area is will, as you do it more, now it's over here, now it's here, and then eventually there's no spots anywhere, and then it's easy in every vertebrae. The difficulty is that to address the spots that you had symptoms in, you need this guy. But the biggest misalignment that you have is where I have it now. Do you understand? Now, that doesn't mean that you can't. I want all the spots worked on, but if you were here in Sarasota, I would first address the largest stains. You understand? The largest misalignment is that left middle back. Feet together, knees left. Rotate, yeah. Yeah, you got to stretch that out. And then compress, good. Knees back to the right. There you go. I want, knees back up, there you go. I want this to be easy. This should be just...
Yes, the left hand side was actually pretty easy. Right hand side a little bit.
You're stretching out that left side when you do that. I got you.
A little bit, yeah.
I'm just curious. Let's go a little bit lower. There you go. Let's go there. Yeah. Good. Yeah. 20 minutes. This is, as much as I'd like to say that I can change your posture and fix you, I really can't. My job is to make you limber. You understand? To lift you up, get all the vertebrae moving so that your range of motion is higher and you can stretch deeper and change your posture more effectively and better on the stretches. That's why you get adjusted and get all that inflammation out of your back so you can feel a little better while you do the postural work, which takes 6 months, a year. Do you understand? To change your posture permanently, it takes at least 20-minute stretches to do the first checkpoint. I think of it like 3 months, you get about half of where you should be in 3 months, and then the next half takes about a couple of years. So it's a diminishing returns curve. So breathe, exhale, roll to your side, and then roll back on your back. Roll back on your back now. There you go. You okay? Hey, very good, very good. I can tell you've been working on it. Let's try this guy. A little sit up for me. There we go, right there. There we go, yep. There you go. Knees bent. With this, you do a little bit, arms up, do a little bit of a tissue pull downwards. That make sense? Is that too easy?
That's not too easy, okay.
So with the neck one, it's just the same kind of idea. You're kind of middle upper neck. What I usually do is the legs are straight on this guy, and then lay back. I got you. Pick your hand, put it on your forehead. You're gonna actually, your neck wants to go to the left. You want to work on actually going to that right. Maybe you use this hand.
Yeah, actually, I do that too. I do always try to go a little bit.
Maybe not so far. Just a little bit right. Do you understand? So when you're on it, be back and to the right to push more on that right side. I usually say this is like a 1 month prescription because you can make it go the opposite way if you do this too long without being checked. How you feeling?
Feeling great.
Yeah, very good.
Before I came down here, when I lived in Virginia, I was a dealer at a casino for 3 years. So that's what really got the upper back pain, cards.
Wow, 3 years?
3 years doing that.
Okay.
And that's what started the upper back, and then the lower back was well before that.
You have to be really good, man. I don't know how the guys throw those cards out.
I still can't. That's poker dealers. I do.
Oh.
I do blackjack and roulette. And
okay.
That's actually a whole different department.
I was gonna get some cards and have you show me. I'm always like.
I could do a casino shuffle, but I can't do the cool pitching cards.
Yeah, that's like.
Fun fact: when you take the poker class, that's just what the students do all the time. Is they just pitch cards to each other.
It's practicing.
That's what, they know everything else. They got to practice that for hours and hours.
What happens if a card? What happens if a card turns?
Yeah, it's dead hand, and then you get other players that are mad because they pocket aces.
Right.
Oh no, we got to do this. So, yeah, you're in trouble if you keep doing that as a
Everybody's
dealer.
got seven deuce or something, and you're like, okay, see ya.
And then dealers for poker are primarily on tips. So if you're making all the players mad,
yeah, you're gonna
have a bad
You're
night.
a bad night. Okay, all right. So lower back. Anyway, lower back and upper back pain. Tell me about that. How 8-9 years since you've seen a chiropractor?
Yeah. So it initially started when I fell off mechanical bull. You know, it was no big deal. Like, I just rolled off of it and got up. I started watching other people do it, and for 20 minutes, and then right after that, it's like, all right, time to go. I try to move. I can't. Luckily, I got to work from home that day. This was way long ago. Because I had to crawl out of bed. I could.
Right.
So I saw a chiropractor a few months later.
So let's say that happened when you were 23.
Yeah, about.
Okay, and then what was going on in high school? So what was your activities primarily?
I was a baseball player.
Okay.
So a lot of sliding, and I did have an ATV, so I have fallen off of that a few times.
Okay. And when you fell off the bull, you kind of fell onto your hip, onto your lower back, kind of on your butt.
It was like
Who
it was
knows?
almost like I slid
Tumble.
off of it. It was like kind of forward off of it, kind of like a roll flip.
Gotcha. And that's the first time you really had the lower back pain?
Yeah.
I gotcha. And when just the lower back, or does it go down the legs?
It didn't go down the legs then, but 3 times since then,
Okay.
randomly I'll be doing nothing. I just get weak and I need like a cane. I use a golf club
Okay.
to get around. And recently, like a few months ago, it happened again. I was doing nothing. Like, I can't point to anything. I did have a pain shoot down my right leg.
Okay. Nice socks, by the way. I think.
Oh,
Yeah.
yeah.
Anyway.
That's
You felt a twinge down that right leg, you said, before I distract you with the socks. You said that you felt, how long ago was that, down the right leg?
This was probably over the summer, last summer.
Okay. Now, when you saw a chiropractor about this 8-9 years ago, did they take any pictures of you? They didn't
I did have an x-ray.
just...
The whole thing, there's nothing that they
They
could
could
tell.
see.
Yeah.
The spine is supposed to have a curve in it, called a lordosis, and that weight allows the spine to be evenly distributed over all the segments. And local pain in the spine is going to be a joint pain. That's going to be when you fell off the bull and you landed, you jammed the joint, and the joint gets inflamed, kind of like a sprained ankle. So the knuckles in your spine get... Now, sometimes when you have a joint injury, your body will try to change your posture. It'll compensate to try to alleviate stress on the area that's injured. So when you bend forward to put the weight onto the less sensitive structures and take the weight off the sensitive structures, you set yourself up for a disc injury later on. So you said not initially, but then a couple of years later, I started noticing stuff going down my leg. That's because now, along with the things that you described in high school, there had to be preceding injuries, ATV,
Yeah.
stuff that happened in baseball that allowed, even at this age, to have a disc get injured. It's now hitting a nerve, and then that's what gives you that radiating pain down the leg. On the x-ray, we're looking at, all you can primarily see are these vertebrae here. You don't see the cartilage, you just see the space. And as the disc material comes out, that disc will start to get thinner as the material starts to leave where it's supposed to be. That takes a lot of time. And actually, a disc will actually swell before it ruptures and thins out. So actually, it'll look really good on x-ray before it looks really bad. So in early 20s would be, I would only take an MRI of you if I was your chiropractor 8 years ago. I'd be like, let's get an MRI, see if we see any evidence of disc injury, and go from there. The alignment that having a joint injury moves you to accelerates stress on the discs. So that's why you see elderly people rounding forward, right? Right, you have a back injury and your body just goes forward to get away from it. And now this position increases the interdiscal pressure, which then causes the disc to come out eventually with prior injury, and then leads to more nerve pressure, sciatica, pain down the legs. So the care is twofold. One, we typically find all the injuries happening in the last 2 segments in the lower back. So getting the areas that are not injured moving, getting the curve back to your spine is what we're going to be talking about today. Primarily, usually we find that there must be another part of your back that's stiff that allowed this to be injured in the first place, and that's what I'm curious to find. Okay. The pain in the upper back, describe that for me.
That is a different kind of, that's more of discomfort, a little bit of burning, and like I really, really want to crack it.
Gotcha.
Kind of.
In between the shoulder blades?
Right in between them. So like right in the spine, like right in the middle.
Right in the middle here?
Yeah.
Not so much out here.
No.
But right.
Yep, going up and down a little bit.
Okay. And that's been going on for how long?
Ever since at the casino. And I never had great posture, so this made it worse.
Right. Okay.
And
those are attachment pains. What those are is when you're in that posture all day long, these are anchor points in here that you're tugging on. a lot of mechanical stress is on the joints in there. It's going to give you that kind of burning pain, and even the attachments are near the joints, so you're going to have pain from posture. The head's got to be over the shoulders. The more forward the head goes, you're amplifying the torque on that area. So we'll show you some things. That can be that yellow den roll. We got one. We'll get one. I'll show you how to use that. Let me have you just stand up, and then just show me. Just go ahead and just keep looking straight forward. Don't look at your posture. Yeah, you're fine. Yeah, so we definitely have the casino posture. Wow. I mean, just look straight forward. Just relax. I got you, bud. Yeah, we're dealing with pretty severe here. About maybe 3 inches. You know, your center of your shoulder and your ear. Look at me for a second now. I mean, we're dealing with. That's supposed to line up, right? This is your shoulder and that's your ear. From the side, you know, your head's gone forward, and that's just continual stress on that area. I mean, we have to get the head back. It's a postural problem. I would call this a hyperkyphosis, right? So it actually is more elevated on your right side. Can you see that over there easily? Your right side of this side of your back is more elevated than your left. Right shoulder's high. So there's a couple things going on here. So not only, I'm going to exaggerate a little bit for you, not only are you forward, but like this side is more elevated. And when you see the video one day, you'll go, oh, he's right. So I believe we got work to do. And your whole torso is off your chest, your pelvis is to the left.
Oh, wow.
You know, all I do is look at alignment. Head's pretty well centered to your shoulder, but mainly the head's tilted. Really, it's a head tilt that causes it. So when you have an injury to the left side of your neck, it made your head tilt to the right, and then you can't walk around with your head tilted. You understand? So the shoulder tilt is more of a neck tilt that causes the shoulder tilt, and you don't have what we call it stage 2 in chiropractic biophysics. The first misalignment is a head tilt, then the shoulder drop, and then a translation. You understand? So you're in what we call stage 2, which is eventually, if you keep this long enough, your head will start translating. The end game of why we would care about this is that in the alignment that you're in, these non-sensitive, non-feeling cartilage is going to wear out too quickly. When your head's back, you actually can inhale with a lot less restrictions.
It feels like hollow.
A lot less effort to breathe when your head's back over your shoulders. When your head's forward,
I could feel it back there.
it's a common thing that we find is that a lot of people have lung issues or even ability to breathe in deeply, and it's connected with your head being forward. And how important is it to breathe? Well, kind of a lot. And so the second thing to do is keep your head forward or keep it where it wants to be. And now try to lift up your arms from the side. From the side, just kind of lift your arms up as high as you can. Right? Now relax, No, it's okay. Now bring your head back as best you can. Now try to lift your arms up. All right, a little better, but still, we got work. I want to do that at the end because you really aren't even able to get your head back. It's tough. But if you watch me, like if I push my head forward, that's as high as I can lift my arms. Do you understand? Now if I bring my head back,
Oh,
do you understand?
I didn't even come close.
That's connected with your head being forward. That your range of motion of your shoulder, the health of your shoulder, is connected with your neck. So, Ed, I'm getting rotator cuff or labrum issues in my shoulder, and it's like, well, that's because your head's forward, and the health of your shoulder, not only neurologically, but the range of motion of your shoulder and the movement of your shoulder keeps that joint clean. So your inability to actually move the shoulder through a complete range of motion builds up crystals and plaque in the shoulder, frozen shoulder.
I was a pitcher when I was. Do you think that helped or contributed?
Definitely adds to it, 100%. All right, deep breath in for me. Head back for me. Exhale. Just relax, I got you. Deep breath in, I got you. Let it go, exhale. All right, deep breath in. One more. Head back, chin down, let it go. Oh, shoulder there, okay. Yeah, we got work to do. It's okay.
That first one, I felt great.
You did great.
It felt great. Okay.
Scoot down for me, and then on your side. Take a deep breath in. Exhale. Relax. There you go. One more time. Exhale. Oh boy, other side for me. Other side. Yeah, stuck there. Hips are stuck. Exhale. All right, face up for me. Yeah. Yeah, those SI joints are, I would say, frozen.
What was that, Ed? What was the purpose of that side posture adjustment? We were trying to adjust this joint here called the sacroiliac joint. So you're on your side, and this is the most powerful joint in the lower back. If this joint's not working, do you see how the lower back joints are under more stress? This joint here participates in the mobility of your lower back, in moving and bending. So when these joints aren't moving properly, extra stress is put on the lower back joints. So when I had you on your side, I'm contacting what we call the posterior superior iliac spine, and I'm trying to rock and move that joint. It gave me nothing. I mean, it felt like I was pushing on a hard wall.
Oh, wow.
So part of what can happen even at let's say a teenage level, injuries that lock this joint, then you're on a bowl with this doing most of the work, so that when you fell, a disproportionate amount of force went into an area because the areas around weren't working. So it doesn't surprise me that you have lower back pain when this is tight. Well, somebody's got to work to actually get you in and out of the car, and that's why this is doing all of it. So the rearranging and transitioning of stress to the other areas around is part of your care. Let me find this thing. Yeah. So this knot here on the left. Yeah, left atlas. So the left side, this is about, your neck must have gotten whipped. It could have gotten whipped, and the left side of your neck got injured. And then as a result of your left side of your neck getting injured, your head tilted. And then that whole dynamic shifted around. Probably 8-10 years ago. That sounds about right. Oh, I got you. Real gentle. Real easy. Just this top guy a little bit. There we go. You okay?
Yeah.
Yeah. We're going to go deeper. I want to just see how it moves cold. So, Ed, you didn't massage me first. Why didn't you massage me? I wanted to get an idea of how your spine moves without anything being warmed up. Does that make sense? Tells me how healthy it is. I got you. Just this top guy a little bit. I got you. There we go. Yeah, a little tight there. All right. So the top part of your neck, called the atlas and axis, are the top two vertebrae. They're supposed to be doing something like 60% of the range of motion of your neck. When the upper neck is tight, the lower neck gets overstressed. When the lower neck gets overstressed, your head goes forward. And so ultimately, forward head posture is a domino effect from the upper neck getting tight. The alignment that you're in when you're dealing cards puts you in a position where this area is going to be tight, the lower neck's overstressed, and then that creates a positive feedback loop. Every day you keep getting more and more forward, and no one cared. And then that burning pain in between your shoulder blades is just like 6 dominoes down the line.
Yeah.
We got to get the head back. Your neck belongs, way back here. And we also got to get the chest in order to even bring the head back. We got to get the chest in. So it's just a lot of loosening up. We adjust, massage, gua sha, and then adjust again, and then stretch, and it's like cycles of that. That is how you change someone's posture. Like clay or like metal, you have to heat it up to make it soft and supple. So it's kind of just a song and dance as hello my honey, hello my baby. My wife's like, really, Ed? Hello my ragtime girl. There's that Warner Brothers frog, you ever see that cartoon, right? With a guy discovers a frog, it comes out, starts to sing and dance, and then, then he tries to, he thinks he's going to be a millionaire because he's going to be able to have this performing frog, but anytime he puts it on stage in front of people, it just sits there and croaks, He's like, no, it's a singing, dancing frog, I swear. And they all think he's crazy.
You're like a living jukebox and you just know.
Baby, my heart's on fire. If you choose me, honey, you lose me. And then you'll be left alone. Oh, baby, telephone and tell me I'm you. That's right. Feel this knot right here. Wow. Your head doesn't want to tilt left.
Yeah, it feels way different.
Yeah. Look at the knot right there. Like I said, usually what happens is the joint gets jammed on the left and then your head healed to the right. Like you healed in avoidance. And that's part of what's creating that even your right shoulder blade being elevated more posterior is a reflection of this neck misalignment. All right. There we go. And you're pretty young for this. You're 33 is a really pretty young age to be hitting it this hard, to be at this position. I mean, 26 is full skeletal maturity. Like the clay is fully hardened, and now we gotta a good place to change it, but
Yeah, after watching your videos, I'm like, I don't want to wait till I'm 50 to go see Dr.
gosh, I'll be like, no. Hi, no. Yeah, it's gonna come up pretty dark here. Right, just a lot of acidity. You'll see the mark right here on your neck when you get home. And we'll take a picture in a minute, but yeah, right there's a lot of lactic acid. Right. Both sides are, responsible. The forward head posture is going to cause tension on both sides, but there's definitely double, triple what's on the left.
Mm.
There's definitely some right here too. Relax this side right there. Let it go. Okay, good. It's okay. Relax. There we go. A little bit more.
The only thing I had done with the chiropractor was he put a heating pad on my lower back and then did the crossover thing with where your leg goes over and
On the side.
yeah,
Yeah.
cracked it both ways, and then that was the whole visit.
Cool. I'm doing way too much around here. I gotta start. So we want to never put a heating pad on your lower back because that's actually where it's injured, right? If you put heat on something, you're actually loosening it more. If you have a disc that's already in trouble, you're swelling it and making it rupture more. So yeah, we don't ever put a heating pad on your lower back. Middle back would be fine to loosen the middle back to move stress off the lower back. But see, my profession is inundated with therapists, right? Guys that want to do something. If you injure a joint in your lower back, the muscles will get tight to protect the injured joint. So somebody will look at those tight muscles and say, well, that's not good. Those muscles are tight. That's bad. But those tight muscles are there because they're trying to protect the injured structure underneath. So that's actually a good thing. The tight muscles are actually helping protect your injury. No, we got to get rid of those tight muscles. Here's a muscle relaxant. Like, well, no, hold on. How about we get rid of the reason for why the muscles are tight? Not just simply treating the symptom of muscle spasms. Ed, stop asking all these questions. Shh, calm down. Just calm down, Ed. You're thinking about this too much. It's like somehow your body decided to annoy you one day and create all this tension. Right? Like it just,
Right.
And they do. There's always like a subtle, underlying tone of your body's untrustworthy. Right? Your body's out to get you. No, the body's extremely intelligent. You don't understand what it's doing. Would be a better narrative in my opinion.
Right.
It's actually way more complicated than you know. And just because you don't understand what it's doing doesn't mean it's doing something wrong. That could go on a t-shirt. It's mainly around the side there, not so much on the back side here, but right on the side. It was a side whiplash, would be my guess. The neck. See, if it was front to back, I'd see a lot back here.
Mm-hmm.
You're saying I don't have as much on the back side of the neck. This was a side, like if you're looking for a second, something happened where your neck got, like that. It was a side whiplash versus a front to back whiplash.
Probably the ATV because I'm whipping around.
Something got,
I
and then
fell off this. I don't know.
yeah, it's okay. I'm just saying something happened on that left side where it got jammed, and then your neck was like, oh, there we go. Right, and then you healed here. Nobody, we don't have any alignment specialists that looked at you and said, let's try to not let you heal crooked. This just needs time. This is going back to what I said earlier. It's healed in the wrong position. So now we have to spend time working on the soft tissue, releasing the glue and adhesions that have built up in the soft tissue and the joints that have allowed you to just become stuck, forwardly rotated in this hyperkyphosis. This is, this curve here has gotten, probably 30, 40 degrees larger than it's supposed to be, and it's taken out of the curve of your lower back and your neck. So curve can't be
we would say created or destroyed. It just changes places. So when you lose curve in your lower back, it goes into your chest, or you lose curve in your neck, it goes into your chest. And so to actually get the curves back in your neck and lower back, we have to take it out of this excessive curve up here. This has to go down.
This side is making
Yes.
my arm twitch more.
Yep, yes sir. Yeah, these are all the nerves that go down your arm coming through these channels in here. This is the more elevated side. This is going to be more difficult over here.
Oh, that's why.
Yeah. No, it's like I said, when you could see it so easily when you were just standing, this was all pronounced. You still watch baseball much, or nah?
I used to, like 15 years ago. But the only sport I watch now is football.
Okay, all right.
But even then, I fell off of that because when I was working at the casino, I was working nights, so
Got you missing.
and weekends. So every Sunday, I would.
Kinda
I mean,
miss-
I could kind of watch it if I could get the right table
Mhm.
at the casino. I could glance over, but I fell off after that.
Gotcha.
It was way more fun to play baseball and watch it for me.
Gotcha. I gotcha. Go. Oh, man. Yeah, right in there. Gee whiz. All right, take it. Yeah, okay, all right, breathe. There you go. Oh, wow. This is preventing you from getting your head back right here. This is a wall. It has to be bulldozed, jackhammered. Right there, wow. Alright, okay.
So this part of your back is supposed to have worked before this, right? So you shouldn't be able to injure this if this was functioning. So the care is to restore the original movement pattern whereby this area does most of the work and then your lower back goes on vacation. The curve in the spine maintains that. When we sit predominantly, or years of injuries and bending forward, that curve goes lost, and then that just keeps the continual movement of stress down to your lower back, keeps your middle back tight. A lot of what the burning pain is the acidity. So when we take a picture of your back in a minute, you'll see a lot of the, we'll say, temporary reasons for why you hurt. Ultimately, all this acidity builds up based on your posture. So we can live in a very short-term world where you get combed and massaged and you feel better for a few days, or go to a chiropractor and you feel better for a few days. But if we don't change the alignment, it gets depressing, right? I felt better, I felt great for 3 days, and then it went right back to where it was, right? And so the long-term has to be care aimed at getting your ear over your shoulders. You understand? We have to reduce that severe, rounded forwardness and head forward posture. Is it usually always the right leg that the pain shoots down? Does it ever shoot down the left, or is it only the right?
I've only felt it in the right.
Okay, and the reason, so your right upper is elevated, your left lower is elevated. That causes a right lower abuse. So this is actually, can you see that crown from there? You see that?
Oh, yeah.
Is that obvious? When we're on your side doing the side posture, we're trying to loosen this joint. The joint's right at the top part of the joint. Oh my gosh, Ed, that is sore. I know. You can't have any tenderness, no soreness on that joint. Sitting locks this joint.
Oh, wow.
We gotta work through it. You're saying it's just a lot of that. There's the burning. There's all that's got to be cleaned out of there. We got to get your posture up right. Breathe, come on. There you go. I had no idea all that was in there, Ed. I know, it's a joint. Okay. Put those on top of each other and then keep the forehead on. Yeah, perfect. Bring it up a little bit. I got you, bud. There we go. Perfect. I got you. Breathe. 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 Oh boy, that is solid granite. There we go, yes. You see what I'm trying to do?
Yeah.
This all has to go this direction. We got a little extra movement there. All right. You put your hands down for me. Got it. Breathe. Okay. we just gotta work on arching your back. Okay. You've lost, right, your ability to bend back. But this area, by being so far, forward, you can. And so in order even to adjust you, I tried to arch your back to get those joints to go back to place. Now what we need to do is you'd have to stretch, get another adjustment, massage, then we try it again. Does that make sense? It takes cycles of that, and eventually you get to a place where it becomes like butter.
Right.
There's no restriction in there. Nice. Okay, good. Scoot up for me a little bit. Sorry. Relax. Okay, good. All right, maybe sit for me. Here we go. Go ahead and tilt your head left for me. Tilt your head left. There we go. There we go. Tilt your head to the left. Okay. Go ahead and keep your head straight for a second. 1 second. Okay, go ahead and tilt right, tilt right, tilt right. There we go. It's our fun ones.
Yeah.
Tilt to the right. There we go.
I always see you do that. I
What
finally
in the
get to
world-
experience it.
What's he doing in there? Give me 1 second. I'm gonna grab a general. And put those arms to the side, baby. Just relax those arms down. There we go. See if we can relax them down. Yeah. Yeah, we gotta work on. Wow. Wow. Like getting even your pecs stretched out. Does that make sense? All this on the front part of your body is so tense. In order to get the chest in, the front has to stretch open. So you'll actually notice as we stretch more, Ed, my sternum on the front's getting sore because that has to open up like a beautiful butterfly, to allow the chest to go in. Now the range for this device is anywhere in between your shoulder blades. So you have about 6 inches of material. You understand the whole length in between your shoulder blades, you can make contact in there. The idea is to make the contact and get that downward tissue pull, right? So the tissue can slide around. You want to make your contact and then have a downward. Does that make sense? So it feels like it's tugging downwards. To do that, you just push with your feet and slide like that. Get the idea?
Okay.
So that looks perfect. You just let the arms relax. Does that make sense? Like the tissue actually moves, right? So you want to have it feeling like it's a downward slide on your back. Does that make sense? No?
I think
So the general makes its contact. I don't want it like that. I want it to feel like it's sliding downwards.
Oh, okay.
So that the dendral actually is holding a downwards pull on your spine.
Okay.
The vertebrae, I don't want it ever feeling like it's going upwards. So that would be undoing it. We want to fold maybe this will help. I want it to feel like the tissue's being
Okay.
pushed downwards. I don't want it to go like this, pulling it upwards. That would then round you forward, right? We want to make the contact and then have it pressing down. Here we go, relax. Get the idea?
Yeah.
Like you're still floating. Right? That's how large the misalignment is that when I put this behind your back, you still can't get your head. It doesn't want to arch. And as this takes time, you have to be adjusted, 20-minute stretch, and do it again. Make your contact. But do you see how my head's just
Yeah.
right? Your back wants to be rounded. I can't do it, Ed. You understand? Because of the roundedness.
Mm-hmm.
And then I go show off. You understand? You're supposed to. This thing needs to be propped up. Not with these blocks, but similar looking block. That makes sense.
Mm-hmm.
And then you're elevated. The block. Then your head still touches the ground. But notice my neck is not stretching.
Right.
My neck is not. I'm not doing this. I'm stretching my neck.
right? But this is a back stretch. And see, the dentaral's not sliding on me. That's the tissue pole. Do you understand?
Mm-hmm.
You want to have that downward tissue pole. And you just hold. Oh. Daggone, you show off. You see my point?
Mhm.
It's not power that I have. It's no resistance. You have a lot more resistance in your back. You actually have bigger muscles than me. But the resistance to actually getting those joints to close is so resistant. So even though your back muscles are stronger, the joint doesn't slide.
Mhm.
Do you follow me? Like
Right.
there's no resistance in my back.
Yeah, I could.
That's things you can do throughout your life, though. Is I want you practicing. You know, they do it in yoga like, different ways. They do one where you grab your. Right, there you go. Show off. But you want to work on.
It's as high as I can get.
It's okay. These are little things that you can do to help.
Doing that, though.
You're doing great. You're doing great. I'm just saying these are other avenues that you can use to help fight this battle, because it's a large battle, and if you were in Sarasota, it would be like 3 to 6 months to get 50% of it done. Do you understand?
Right.
And then the next 25% would be like a year. You understand? So in a year and a half, we'd be 75% done.
Mm-hmm.
It's like orthodontistry. It takes like 2 years to move your teeth, a few millimeters. It's orthodontistry to your back. And so it can't be done just by a few adjustments. That has to be, you have to hold. And then yeah, Ed, in the evenings now, I lay on my belly and I watch TV like this, right? Instead of every evening, right? This feeds it, right? This feeds the hunch. And, well, this is comfortable. I like my lazy boy, but that's feeding your problem. So we want to also involve fasting from all the things that round you forward as best we can. It's what's practical and what you can handle. Onto your chest. If you're like this for like 20 minutes, your shoulders will start hurting. So my point is you put the weight onto your chest. Do you understand?
Yeah.
Instead of it being on your shoulders.
Mm-hmm.
If you can do this, and it's not harming your shoulder, but if you spend 20 minutes like this with the weight on my shoulders will hurt after 20, 30
Right.
minutes. It's nothing wrong with your shoulder, it's just you're jamming the shoulder joint. So you gotta get the weight onto your chest, put pillows or blocks or rollers so that you don't, so that it's really not the shoulder that's under pressure.
Hurts everywhere now except where it was burning.
Well, good. Well, that's what I'm saying. I'm moving look straight forward. I got you. Yeah. It's gonna take. You're right. It's about 2 inches now. You're about 1 inch. We went from 3 inches to 2. You've been here at 3 so long that you can't get to 0, right? Let alone -3. Does that make sense? We're trying to overcorrect. So if you're at +3, we have to take you to -3 so that you'll be at 0, right? You're at +3, and we just stretched to like -1 or +1. Does that make sense?
Right.
So now you're at +2. Aren't you happy yet? No. I want you at 0. Right? It's an overcorrection to get to the middle. I bring the arms up. I'm just curious to see.
Oh yeah,
Give that a shot. Yeah, try to stand up. And then. Yeah. Look at you. You're gonna get it. We're gonna get it. Like I said, it's those arms should be able to come straight up.
It's better than it was.
You're doing great. That's what we have to get to. Here we go. Turn your head towards me a little bit. I'm gonna put the back of your head in that little slit area, just like that. Perfect. There we go. I got you. Feel that?
Oh, got it.
Yeah. It shouldn't take an hour to get that joint moving. And I might have been able to get it to move earlier, but I wanted to be careful about not moving this.
Right.
Do you understand?
Yeah.
The more power you put into an adjustment, the more likely it's not to be exactly where you want it to go, right? Your accuracy goes down when you go with more force. So we're trying to adjust this without adjusting that. And your lower back, this SI joint was so stiff and this is so loose that we got to be careful when people adjust you like that like nobody ever does this. You're saying nobody takes their hand and should be adjusting your lower back ever. Let me say somebody ever contacts you and goes, okay, we're going to adjust L5 and run out the door.
Okay.
There we go, it moved a little bit. Yeah. All right, it's good. But yeah, way too stiff in there.
just happy you got it at all.
What is it?
I'm just happy you got it at all.
Yeah, no, it's, you need, that's when I was adjusting, when I was massaging, it's, you were like,
Yeah, that was intense for sure.
all right, how you feeling? You okay?
I feel amazing.
All right,
I,
good.
it's sore everywhere, and I like the feeling. It means you did something right.